Smita, Dr. Roop is saying that they are not able to join. So you'll have to open it.
That's it. The room is open and the session is live.
Yeah, I think Dr. Roop was saying he couldn't join in, but now probably he will be able to.
Hi, Dr. Joy. Dr. Joy, good evening.
Yeah, hi, good evening.
How are you?
Good, good. How are you?
I'm also good.
You can have your video on, Doctor.
Let me try. Today I'm facing some problem in my video. Let me check.
No worries. I think the participants are joining in now. We've just opened it, so
Okay.
there are people coming in. My students will be in, and Dr. Roop Gursani is here. Hi, Roop. Sorry, sometimes the room takes a bit to open, Roop, so there was a little delay. My
Not a,
apologies.
no problems. You got 60 participants, not bad.
Yep, I think this is an important subject. So I think sleep is an important subject, but somehow neurologists haven't woken up to it yet. We'll get there.
No, it's not only the neurologist, the whole medical community is sleeping over it.
Yeah, we'll get there in a bit.
Our,
So
our medical curriculum is teaching us only from wake people or from dead people. Dead
yes,
people in the anatomy dissection hall and wake people in the OPD. So sleeping part is totally ignored by our medical curriculum.
it's true. Hi, Sudhir. Nice to see you. Despite of being in Arunachal with the birds, I hope you
Hey,
can.
isn't he back yet?
Yeah, he's in Arunachal Pradesh with birding, but the glymphatic is his favorite subject since I spoke about it a couple of years ago, and then we've been tossing literature and case series back and forth. So I,
I,
I'd asked him, but hi,
my
hi,
my
hi. Good to see you, Sudhir.
my connection is still so I'll be there as much as I can. If a table connect,
Yeah, no worries.
but
Asmita, can we start?
forward to it.
Uh,
Yes,
Asmita,
sir,
can
you
we
can
start?
start.
Could I
Yes,
introduce Dr.
yes, sir.
Singh? So, hello, good evening, everyone. Welcome to one more edition of the sleep subsection webinars. And it's my pleasure to invite Dr. Tripardeep Singh. Dr. Singh graduated with MBBS from the Government Medical College in Patiala, Punjab. He did his post-graduation in physiology from Vallabhbhai Patel Chest Institute, University of Delhi. And he specializes in sleep medicine as an international sleep specialist, the World Sleep Federation program, and the sleep technology as a registered polysomnography technologist. And for all of you who have attended many of his lectures in sleep meetings, he's a very astute somnologist and interpreter of sleep studies. He has till date written 6 books. He's an associate editor with the American Association of Sleep Technology textbook. He's the editor of the ISSR newsletter, Sleep Watching. He's an ardent artist and a big advocate for sleep for brain health. So it's my great pleasure to invite Dr. Singh to be amongst us today. And for all of us, he's going to speak to us about his insights into the physiology of the glymphatic system since its discovery in 2013 in October by Mike and Nedegard, and the revolutionary way in which it has changed the way we see the pathophysiology of numerous disorders in sleep. So, Dr. Singh, welcome. It's my pleasure to have you. And the stage is all yours. You could go ahead with your talk.
Thanks, Dr. Joy, for giving this opportunity and sharing my little bit of knowledge on this important system. And let me share my screen. Dr. Joy, can you confirm that you can see the screen?
Yes, sir.
Yes,
Perfect.
yes, we can see your slides. It's very good.
Okay, good. So, good evening, everyone. So, I'll be discussing about one very important system of our body, that is the glymphatic system. And before I delve into it, I will just like to briefly tell you how this topic became a full-fledged lecture series, basically. So when I was preparing my sleep medicine and sleep technology courses, I suddenly realized that sleep medicine or sleep medical curriculum is totally ignoring sleep physiology. That is how every system changes their function during sleep. And when we started preparing this course from the sleep perspective, that how every system changes during function during sleep, that is when this particular system took the current shape that I'm going to share with you. So I'll be starting with the traditional knowledge around lymphatic system. Before that, functions of sleep, there are a lot of theories around it. Energy restoration, immune system strengthening, decreased oxidative stress, memory processing, and brain development. But yes, these processes are important for anyone. But in animals, what they have shown is 7 days of sleep loss can lead to death of the animal, which that means some structural changes also must be happening. But these theories were not explaining any structural changes that can happen with sleep deprivation. And that is when in 2014, this first study came, which showed that sleep loss leads to dendrite loss in a very important brain structure called Locus coeruleus. And I'll come to this slide again after a while. That means sleep loss not only changes certain functions that are happening in the body, there are structural losses in the neurons in specific structures, especially locus coeruleus. Now, what we knew about lymphatic system was that whole body have got the lymphatic system, but brain didn't have the lymphatic system. That was our traditional understanding till 2013. Now, if we look at the function of lymphatic system, this lymphatic system clears 24 gram of protein from our different parts of the body. And brain also has a turnover of 7 gram of protein in a day. If brain do not have lymphatic system and this protein is not being cleared, then this will get deposited in the neurons. Like in Alzheimer's, it can appear as plaques. In Parkinson's, it can appear as Lewy bodies, or prime amyloid plaques can be seen. In amyotrophic lateral sclerosis, aggregates can be seen, or in Huntington's, intranuclear occlusions can be seen. But everybody is not predisposed to this. That means this protein must be getting cleared from the brain somehow, and that is exactly what we didn't knew until 2013. One of the theories was that cerebrospinal fluid in some way might be clearing this proteins, but how does this is happening was not at all clear. So basically, if you look at different clearance mechanisms for the neurotoxic proteins from the brain, cerebrospinal fluid is clearly proposed as one of the important mechanisms which clear beta amyloids and other tau proteins from the brain interstitium. But how is this happening? That was the area of interest which became clear in 2013 with the discovery of the glymphatic system. Now, this glymphatic system basically is organized around the blood vessels of the brain. Okay, and what is happening is there is a very unique structure which is present only in the blood vessels in the brain and not anywhere in the body. And that structure is basically that the astrocytes, they completely surround the blood vessels. So if you see, this is the blood vessel lumen, and these are the astrocyte foot processes. They completely encircle this blood vessel. As a result of this encircling of astrocyte foot processes of the blood vessel, we get a very unique space between the blood vessel and the astrocyte foot processes, which is basically called the perivascular space around the blood vessel. And this unique structure is what helps the glymphatic system to function. And I'll elaborate on that in a while. So if you see this astrocytes foot processes, they are encircling not only the arteries, they are also encircling the venous side. And somehow the CSF in this periarterial spaces or perivenous spaces, in the periarterial spaces, this CSF can come out of this part and wash the proteins from the brain parenchyma and go towards the venous side for drainage into the systemic circulation. And the way this CSF moves out of these periarterial spaces is once it comes out of these small channels, and I'll come to these channels, what are they? It has a convective flow to move from the artery side towards the venous side, washing away the proteins. Now, what has become clear is somehow from the periarteriolar space, when the CSF comes out, basically it reaches the venous side on the perivenous side, and somehow it is able to reach the systemic circulation. And that is another area of interest, that how from the perivenous side, this CSF, which has taken away the protein matter from the brain parenchyma, finally reaches the systemic circulation. But before I come to that, what we need to know is how this CSF is coming out of the periarterial space and entering the perivenous space. And that is where one very important channel called aquaporin is present at the foot processes of these astrocytes. Now this aquaporin 4 channels, they are completely present on all the foot processes. And what you see over here is this arterial pulsations are moving the cerebrospinal fluid. As a result, it moves in the periarterial space, and through the aquaporin 4 channel, this CSF finally comes out. So expression of aquaporin 4 channels is of utmost importance for the CSF to come out of periarterial spaces to wash the interstitium, take away the debris and reach the perivenous side. And on the perivenous side also, the astrocytes have got these aquaporin 4 channels through which CSF enters the perivenous space. Now, the important question that was lingering was, from the perivenous space, how does the CSF finally reaches the systemic circulation? And that is where it has been shown now that this glymphatic system from the perivenous side have got connections with the meningeal lymphatic system. And from the meningeal lymphatics has been also shown as an entity now, and it has been clearly labeled. You can see the green tracer, which is highlighting the meningeal lymphatics. And what we now know is that glymphatic and meningeal lymphatic systems, they are interconnected. So from the perivenous side, like from the CSF from the periarterial side goes out of aquaporin 4 channels to the brain parenchyma. And on the perivenous side, entering the perivenous space through aquaporin 4 channels, it finally reaches the meningeal lymphatics and drains from there into the systemic circulation. And the first site, if this is true, should be the deep cervical lymph nodes, because that is where the meningeal lymphatics drain first of all. And to prove this point, they have very clearly shown that if we look at the beta amyloid proteins, their concentration is highest in the brain, and the next highest concentration is in the basically deep cervical lymph nodes. So, and then it drops as the other lymphatic organs are concerned. So the highest concentration is from the meningeal lymph after the brain going through the meningeal lymphatics is in the deep cervical lymph nodes, which proves that these two systems are talking to each other, and the glymphatic system through meningeal lymphatics is taking the washout of all the proteins and throwing into the systemic circulation. Now, after this, the important question was that this glymphatic system, is it active during sleep or during wakefulness? Now, studies have very clearly shown that glymphatic system is most active during sleep. So in this case, this green tracer over here is the sleep state and this orange is the awake state. So when this CSF tracer was injected in the animal, its activity was highest in the CSF during sleep part and not during wake part. Okay, so it has become clear from experiments like this that actually glymphatic system is most active during sleep, and when all the other processes are not functions or are not happening, the glymphatic system is able to clear the brain. But then important question arises, why are there differences in glymphatic clearance during sleep versus awake? So when I started looking for an answer to this question, what I came across was that it is the silencing of locus coeruleus nucleus which increases the glymphatic system activity. Now, the experiment over here have clearly shown that if we give norepinephrine receptor antagonists, so that this is the wake state and this is norepinephrine receptor antagonist, and we know that locus coeruleus is an adrenergic structure which liberates a lot of epinephrine and norepinephrine. So if norepinephrine is blocked, the CSF tracer basically increases. So it's kind of, they showed that silencing of the locus coeruleus is responsible for the glymphatic system activity difference during sleep versus wake, because locus coeruleus is most active during wakefulness and locus coeruleus silences during sleep. Now this was our traditional knowledge till 2013, okay, but this traditional knowledge that locus coeruleus silencing leads to glymphatic system activity, it has been now, there has been a paradigm shift in this thinking, because this study came in 2022 which challenged this traditional view of locus coeruleus being active during wake and not active during non-REM and REM sleep. Rather, this study showed that noradrenergic activity of locus coeruleus is actually present during non-REM sleep. Now, this was a paradigm shift in our understanding in the role of locus coeruleus contributing to wakefulness versus sleep. Now we know that locus coeruleus activity is important in some way for the non-REM sleep also. But what was not clear at this stage was, what does this locus coeruleus firing during non-REM sleep is actually doing? This was not there. Now, this took a couple of years from 2022. In 2025, this January only, just 1 month back, this study came out which have shown that the firing of locus coeruleus during non-REM sleep happens in a very different manner from wakefulness. During wake state, locus coeruleus liberates constant levels of norepinephrine generating wakefulness. But once the animal enters into non-REM sleep, locus coeruleus firing changes from a continuous firing to pulsatile firing in its nature. And this pulsatile firing of the locus coeruleus during non-REM sleep, liberating norepinephrine in pulses, is actually causing the pulsations in the blood vessels by causing vasoconstriction and vasodilatation. And these pulsations, they basically drive the CSF in the periarterial space for the glymphatic system to function. So one thing has become very clear, that we need a healthy locus coeruleus for optimal function during non-REM sleep, and also this pulsatile firing of norepinephrine from locus coeruleus during non-REM sleep actually drives the glymphatic system activity. And this study, what it showed was one very alarming finding, that sleep aid zolpidem, it suppresses norepinephrine oscillations from the locus coeruleus during non-REM sleep, and that impairs the glymphatic flow. So considering zolpidem as a benign hypnotic, they are challenging that notion now. So, and also, as I told you, that if somebody is sleep deprived, locus coeruleus dendrite loss is there. That means locus coeruleus, if becomes diseased, it will not be a healthy locus coeruleus, and that damage to the locus coeruleus can cause disrupted brain and body coordination, impairment of brain plasticity, abnormal levels of noradrenaline, and accelerated neurodegeneration. And it can predispose to dementia also by impairing the glymphatic system activity. Another factor that contributes to this difference between daytime versus nighttime activity of the glymphatic system is that there is circadian control as well on the glymphatic system, and this control is through aquaporin 4 expression, because it has got a circadian rhythm, and that plays an important role in circadian control of CSF distribution. Studies have very clearly shown that this aquaporin 4 expression is highest during sleep, leading to highest activity of glymphatic system during sleep. And if aquaporin 4 levels are knocked out, then basically this difference between daytime and nighttime activity of glymphatic system disappears, because this diurnal variation in aquaporin 4 is a must for this difference in the nighttime and the daytime activity of the glymphatic system. Now, what drives fluid movement in glymphatic system? I have answered it partly, that it is the pulsatile nature of the blood vessels, which is generated by the firing of locus coeruleus and pulsatile release of the norepinephrine, that causes this movement. And this has been very clearly shown in the experiments. If you can see, this is the blood vessel with blood flowing along it, and you can see this green tracer is the is in the periarterial space flowing along the blood vessel. And what has been very clearly shown is that as the heart pumps blood into the vessel, that pulsation combined with norepinephrine pulsations causing that vasodilatation and vasoconstriction is driving these particles in the periarterial space. So basically this has got implications, because in hypertension, once this small vessel disease sets in, you can see here, this is the normal, first graph is the normal blood pressure. You can see these particles accelerating along the periarterial space, whereas in people with high blood pressure, these dyes, they are static and they're sitting around the blood vessels. They're not moving as fast as they can move in the people with normal blood pressure. And this is can be one of the reasons that in high blood pressure people, they are predisposed to develop Alzheimer's disease in future. Now, when I was realizing this, that it is such an important system, at this point of time in the clinic, one very important question was coming to us, and that was, which is the best body position to sleep during sleep? Very simple, benign question coming from the patient, but it was scientifically, it's very difficult to answer. Our best answer used to be whichever body position is comfortable to you, you sleep in that body position. Except if patient have OSA or patient have GERD or patient is pregnant, except in those conditions where we know certain body position can benefit the patient. In general population who are not suffering from these disorders, which body position is most suitable? I was very interested in this question to answer from a scientific point of view. But I could not, when I looked into the literature, scientific literature, there was hardly any evidence. I was looking for which sleep position is best for sleeping at night. Then when science was not giving the answer, I looked into the yogic philosophy. Yogic philosophy says 50% in the left position, 50% in the right lateral body position. I was not very much convinced, because once you fall asleep, controlling your body position is beyond your control. So 50% left and 50% right didn't make much sense to me. I further looked into other philosophies, and I looked into Quran. And Quran, there is one statement stating that one should initiate their sleep. Listen to the words carefully. Initiate their sleep in right lateral body position. Now, they have not said anything that what will happen once you have fallen asleep. They said initiate your sleep in the right lateral body position. Now, yogic philosophy and in the Quran philosophy, one thing was common, the right lateral body position. I immediately refined my research question. What is the effect of right lateral body position on the human physiology? And two studies came out, and one of the studies was this, that if there is an effect of body position on glymphatic system. And this study have clearly shown, compared to supine body position, when the animal is sleeping in the right lateral body position, the glymphatic system activity is maximal. So it makes sense what is written in the Quran, that initiate your sleep in the right lateral body position. But this study have not compared the data for the left lateral body position. So we really don't know what's happening there. Now, the data so far that I've shown you is from animals. Do we have evidence of glymphatic system in humans? We do have. And MRI and sleep deprivation studies are showing this. There is a lot of interest in MRI as a tool to measure glymphatic system activity with different protocols, and recently DTI-ELPS has been shown to be very promising in measuring the glymphatic system activity in humans. And sleep deprivation studies in humans have shown very strong evidence that if slow wave sleep disruption happens, it increases amyloid beta levels. And slow wave sleep, that is your N3 sleep, is the sleep when glymphatic system activity is maximally active. And studies have also shown that even one night of total sleep deprivation increases the cerebrospinal fluid beta amyloid levels in 42 healthy middle-aged men. It was in a randomized controlled trial. And the way they measured it was through MRI and the CSF findings. So coming to that, what I can say now is, if glymphatic system is not working properly, the protein clearance from the brain will not happen, and aggregates of the protein will deposit in the brain, leading to dementia. And this glymphatic system activity being affected is now also being accepted in hydrocephalus, ischemic stroke, traumatic brain injury, brain tumors, and subarachnoid hemorrhage. Now, if this glymphatic system activity is so important, in addition to starting your sleep in the right lateral body position, can we do something else for its improved function? And that is when I started checking what is the impact of lifestyle improvement on this glymphatic system. And that is when I came across these studies that intermittent fasting, it increases aquaporin polarization. That is the polarity which favors the glymphatic system activity. So intermittent fasting is actually favorable for glymphatic system activity. Sleeping position, right lateral body position, increases glymphatic system activity. Regular exercise improves glymphatic clearance by improving the aquaporin polarization. And alcohol, it actually, in small doses, it improves glymphatic system activity. But these are animal studies in which it has been shown, and very low doses. We really don't know what will happen in humans. So I'm not eagerly promoting this fact that small doses of alcohol improves the glymphatic system activity. But chronic ingestion and high doses of alcohol impairs glymphatic system activity. Chronic stress, it alters the aquaporin 4 expression on the astrocytes, thereby impairs the glymphatic system activity. And they have shown that omega-3 polyunsaturated fatty acids improve glymphatic clearance. And there is a lot of interest in modulating the activity of glymphatic system by external maneuvers, like either by sensory stimulation or by transcranial stimulation or through drugs or through behavioral modulation. But the evidence is very weak at this moment. All these techniques that are listed over here, they have shown by sensory stimulation like auditory or vestibular or olfactory, N3 sleep has been increased. And because N3 sleep is the sleep where glymphatic system activity is maximum, they are assuming that if I improve N3 sleep, then glymphatic system activity should also improve. But they have not demonstrated that. Similarly, transcranial stimulation has been shown by different means, have shown to increase N3. Again, they are presupposing that improved N3 will improve the glymphatic system activity. But does it really happen? The evidence is very, very weak at the moment. Pharmacology, I believe, is not the way forward, because you saw one study showed the zolpidem is actually impairing the glymphatic system activity. And many of these drugs, they suppress N3 sleep. If N3 is suppressed, I'm presupposing that it is going to impair the glymphatic system activity, but evidence has not been there yet. So a lot of interest is there in behavioral modulation as well, and one is sleep position. So I have started advising, now answering my patients, that you have to start, if you're the best position to start your sleep is the right lateral body position, but after that it's beyond your control. So what I can say is, to have a healthy glymphatic system is an art, and that art is the amount, regularity and timing of your sleep, your circadian rhythms, and your physical activity, because they are going to impact your glymphatic system activity. So it's not about just going to sleep. Having adequate amount of sleep, regular sleep, and the timing of the sleep is of utmost importance, because if you're sleeping too late, you might be compromising on N3, and the N3 is the sleep when your glymphatic system activity is maximum. So take care of your sleep health in terms of regularity, duration, and timing, and you will have a healthy glymphatic system. So what I can say in end is, animal studies have shown existence of glymphatic system in brain responsible for toxic metabolite clearance. Human MRI and sleep deprivation studies support the presence of glymphatic system in human brain. Astrocytes with aquaporin 4 on their end feet help in CSF-ISF exchange for metabolite clearance. CSF enters brain parenchyma via periarterial spaces and exits via perivenous spaces. Glymphatic system is most active during sleep. Cardiac pulsatility drives the fluid movement, and I want to add here one new point, that is the locus coeruleus firing in a pulsatile manner, liberating norepinephrine, causing vasoconstriction and vasodilatation of the blood vessels, also drives the glymphatic system activity. There exists meningeal lymphatics interconnected with glymphatic system that allows the CSF to reach the systemic circulation. Glymphatic and lymph flow are under circadian control because aquaporin 4 expression increases during night, and disorder of lymphatic system predisposes the person to develop dementia. Thank you so much, and I'm happy to take any questions at this stage.
Thank you, Dr. Singh, for that very elegant exposition on the glymphatics. And a couple of things for qualification. I think Dr. Roop Gursani has been comparing the alcohol dose in your slide to a modest Patiala peg. Let me specify to Roop that the experiment that Dr. Tripaddeep Singh quoted was in mice, and the alcohol was injected into the peritoneum using a syringe. I'm not sure whether it was single malt or it was a blended whiskey. So we really don't know in humans. And the other interesting feature which we all need to understand is that we now have some confirmatory work last year to Thomas Schreiner, and that's been published in Science, to show that it's not just the cardiac pulsatility of the vessel that is a impetus, physiological impetus for the flow of CSF, but it's also the pulsatility of breathing. And therefore, it's not surprising that people who have sleep apnea have been shown on the DTI-ALPS index, which is a surrogate, now accepted surrogate marker of glymphatic efficiency, proven over the last 3-4 years now with numerous Korean, Japanese, and Chinese studies, that it is impaired in people with sleep apnea. So many points to ponder. And one of the other interesting things that came about in literature is that there are single nucleotide polymorphisms for the polarization of aquaporin 4. And I'm not sure of the nomenclature of these polymorphisms. I've forgotten them actually. I read about it a while ago. And apparently, you have genetic polymorphisms which determine how polarized the aquaporin 4 can be on the porocyte. And in the lifestyle phenomenal insights that Dr. Singh gave us, it is true that intermittent fasting, regular exercise can help in polarizing the aquaporin 4 on the astrocyte from the soma to the food processes. And it is this directionality that imparts functional efficiency to glymphatic clearance. So phenomenal. And somebody's asked a question, are there pharmaceutical methods of, we are all drug vendors, so are there pharmaceutical methods to augment the glymphatic system? Well, we know that zolpidem does kind of impede it, but I'm not aware of any drug, and I would like to ask this question to Dr. Singh, and even
No, at the moment, all the evidence is that certain drugs they increase N3, like sodium oxybate, pregabalin, cimetidine, they increase N3. But that is all we know. Whether this increased N3 translates into increased lymphatic system activity, there is no evidence for that.
Absolutely.
They are supposing that if N3 increases, then it may be that lymphatic system activity also might increase. But at this moment, there is no evidence that any drug can improve the lymphatic system activity. Rather, there is evidence to show drugs can impede the activity of lymphatic system like zolpidem.
So one of the other fascinating things that has come about is that Gustavo Roman in, I think, 2018 showed in a series of 31 patients with normal pressure hydrocephalus that out of his 31, virtually 28 had moderate or severe sleep apnea. And following that publication from Houston, there have been now numerous corollary observations from Japan and Korea. And it appears that one of the ways in which glymphatic dysfunction can alter the biological framework of efficiency in the sleeping brain is that it can tip over the balance between CSF absorption and its production. And therefore, in patients with NPH, it is not uncommon to find background sleep apnea. And this is still some understanding in evolution. I mean, there are some vignettes, but there's a lot that we don't know. And how this is going to add up in our surgical strategies for treating treating NPH will change in time. I think there is a question that's been put up on the chat. Let me pose this to. So there's an interesting question. This is, how does glymphatic system behave during naps compared to nocturnal sleep? And I wonder whether Dr. Singh has a take on that.
No, this is a very important question, and what I there is no evidence on this. They have not measured the glymphatic system activity during naps. But what I feel personally is because aquaporin 4 expression is controlled under the circadian rhythm, its expression and polarization increasing towards the night as compared to daytime. So I think naps may not be performing the same function of increasing the glymphatic system activity like the nighttime sleep. That's my take on that, but evidence at this moment does not exist.
Fair.
What happens to lymphatic system activity during naps?
Fair. And there's a question posed by Dr. Girsahani to everyone. Is there any anatomical reason for the right side lying position benefits?
No
So
explanations at the
I
moment.
also don't have a good idea on this. I had read about the right lateral position in the original work of Mike and Nergard and Jeffrey Eliff, and they did a lot of initial work, and most of their publications did show that, but I don't have an answer to this, so
No,
I really don't.
they have not explained why this increases during right lateral body position, and also the lacuna is they have not compared it with the left lateral body position. So we really don't know what happens over there.
And I think there was some evidence in the original Mike and Nergard and Jeffrey Eliff's work that being prone impedes the glymphatic clearance by almost 40%, especially in mice. So
Right.
we have something there. Um, I
But the
mean, the
modulation is
way
still
I
not.
see it, Doc, is that this whole our understanding and the discovery in the last say 11, 12 years now have changed the way we ought to think about sleep. And we've always kind of understood then and believed innately and incorrectly, obviously, that late nights are okay because we can make up for it by sleeping longer. At least now, from objective data from actigraphy studies and a lot of studies done by numerous workers around the globe, circadian asynchrony is as harmful as having a sleep disorder in terms of impairment in glymphatic efficiency or biological clearance of protein fragments. So a lot of things that we took for granted, we need to perhaps rethink. And there is great room for advocacy in speaking about the value of sleep hygiene as a brain protectant across lifespan. And would you agree, Doc, that
Yeah,
that's...
I fully agree with your observations.
And there's one more question here. I have raised ICT, glymphatic drainage is decreased. Does it mean that I go for tapping 4 monthly? Now, this is a question from Seema Tiwari to everyone. And Dr. Singh, do you want to take that, or shall we
No,
want me to
no,
have a go?
no, you take it.
Yeah, so this question is a little complex. I presume from the wording of the question that the individual is asking about idiopathic intracranial hypertension. And most of us neurologists, both young and old, will kind of agree that our understanding of IIH is a bit modest. What is very clear that there is seems to be a great physiological link to obesity, and in all the patients who have been treated with various manipulative measures to divert CSF fluid, either in the form of a thicoperitoneal shunt or other measures to reduce production of cerebrospinal fluid. One of the things that really works is weight loss, and how that changes the CSF dynamics is something that has not been well understood. So, yeah, I think this understanding is still in evolution, and every patient who has idiopathic intracranial hypertension will have to have their own individual um, advice from their treating physician or neurosurgeon, depending on who it is. And we are fortunate to have Dr. Roop Gursani, who's a very seasoned and erudite neurologist amongst us. Roop, you have any thoughts on today's deliberation?
No, not really.
So,
I think
Lata
that's a
Kasturi,
very
who's...
tricky question.
So there's a question from Lata, who's she's a sleep coach, I understand, in Hyderabad. So how do we address the global citizens with teams from Japan to USA? And I'm not able to fathom. Uh,
No, basically, she's talking about people who are traveling too often and crossing too many time zones
oh, their brains are at certainly risk.
and disrupting the circadian rhythms.
The
Definitely, they are.
circadian disruption is as much a disruptor of
Yeah,
physiology.
yeah.
They are certainly at risk. There's a question from somebody else, I think Karuna Datta.
That's
Interesting to study effects of yoga nidra. Is it shown to be effective in insomnia? Doc, you want to take that? I don't know
I
much
think
about
it's
yoga
more
nidra.
of it's not a question, it's more of a comment that we really don't know what Yoga Nidra will do to the glymphatic system, but it will be definitely worth seeing the effects of Yoga Nidra and the glymphatic system function.
Yes. So you'll all agree that, I mean, I personally think that as a neurologist, after the advent in the last 10 years since the discovery of the glymphatics, our whole thinking of sleep biology and its complex interplay with the entire umbrella and gamut of neurological disorders that we deal with has changed. And I have made it a habit to take a sleep history in every patient that I see. And we are trying to make sense of all the nuances of what lifestyle could be doing to the burden of what these patients are seeking help for. And I suppose in time we will learn more, but every one has a story, and every patient that we see teaches us something new. And I think today's very enlightening and very lucid with those beautiful diagrams that you were able to tell us about the glymphatic system will be very useful to everyone who's attended today. The diagrams were absolutely strikingly crisp and clear.
Thanks.
Okay.
There is one question we can address in the chat. Are there any specific sleep disorders that disrupt lymphatic clearance?
Oh, yes, absolutely. So, Doc, you want to have a go, and then I'll also have a go at
Yeah.
this.
Obstructive sleep apnea, even restless leg syndrome, now recent evidence have shown disruption of the glymphatic system in that. And your circadian rhythm disorders can also have impact on your this. Jet lag definitely can impact on your glymphatic system activity.
Absolutely. And I think there is some emerging evidence for cerebral small vessel disease. So it's both a cause and effect
Hypertension.
bidirectional thing. So when once there is small vessel disease, one of the contributors to permeability change across the blood-brain barrier is glymphatic dysfunction, and that gets perpetuated, producing small vessel disease, and that can further perpetuate the efficiency of the underlying lymphatics. Because the lymphatics, it appears, is very largely oriented in the brain from the large mass of the interstitium available for CSF flow across what is known, identified as the centrum semioval on the MRI, and the lateral white matter tracts. I mean, that constitutes the very big volume of brain tissue amenable to CSF flow. And what I understand from literature is that when the human brain sleeps, as do animal brains, the interstitium actually expands by almost as much as 40%. So there is a adaptation to allow this biological washing machine to actually function well. There is a question, any association established between lymphatic system and Parkinson's disease? And I can tell you certainly yes. There are a whole bunch of review articles in the last 2 years talking about impaired lymphatics in synuclein disorders. And there is a growing interest in sleep biological features, pre-symptomatic, that can abet and worsen the susceptibility to abnormal synuclein in the brain. But yes, even if you did a good search, you will get the information across.
All right.
Super. Uh, so there are some more questions.
It's comment only.
Yes, so somebody has said pimavanserin increases N3 sleep, and Dr. Damija has asked any relationship to dreams. So
That part really means I've never come across any literature where dreams and lymphatic system activity. I'm not aware of that.
that's a complex question, and dreams now, again, the biology of human dreaming has undergone a dramatic change. I think 10, 15 years ago, it was conceptualized that dreaming is a dominantly REM sleep phenomenon, but now we know that dreaming does occur in N3 sleep too, and the strict division between phases of sleep is not a accepted construct now. And to muddy the waters a bit further is also the emerging concept of focal and segmental sleep in the brain, based on how much activity has been done during the day, and that makes it complex. So we don't have a good answer to the dreaming question.
I agree.
Yes, one of the DM residents has asked that what happens to cases like neuromyelitis optica, abnormalities in the glymphatic system. And I have not read any literature on anyone who has studied specifically glymphatic dysfunction in patients who have proven neuromyelitis optica, but I wouldn't be surprised if the system was dysfunctional in these individuals, because any inflammatory process is likely to alter the functional smoothness of the system. But I have not read any literature, and I'm not in a position to give an answer to that question.
No, neither me.
Okay, super. So,
Okay.
Dr. Tripadeep Singh, I'm very grateful that you could come. I attended your previous talk too, and I really enjoyed the way you put together your conceptualization of slides and your ability to convey complex information in a very simple manner. And it was my privilege to have you here with us today in the sleep subsection of the Indian Academy of Neurology. Thank you for taking time out from your busy schedule and speaking
Thanks
to
for
all of
having,
us.
thanks for having me here, Dr. Joy. Thank you so much.
Good night.
Good night, everyone,
Good
and
night.
thank you for attending.
Thank you. Bye.